So let's talk for a second about breast reduction consultations and what you as the patient should think about before you come in. So there's lots of different ways to do breast reductions and there's lots of potential outcomes. So it's really important that you as a patient have a little bit of an idea about what you're looking for. So I always recommend to people not to get too fixated on cup sizes because we can't promise cup sizes, but think about what proportion you'd like. Think about if you buy a bathing suit, would you want the top and bottom to be the same size, both medium for example? Would you want to be smaller on top when compared to the bottom, maybe larger on top when compared to the bottom? That's really helpful information for your plastic surgeon. Now, when you say you want to be really small, so this is a unique population of people, I always ask patients, what's your personal aesthetic? A small female breast, a flat chest, or a male appearing chest? I can't tell you how many patients come in saying they want to be as small as possible. I ask them that question and they're not sure. And they go home and think about it and call me back and say, actually, I think I prefer a flat chest. This is really important to think about before your consultation, because how we do the surgery is very different for all of those three options. And I really want to know what's important to you. And then finally, I know this sounds weird, but think about how you feel about areola size. So we have some ability to affect areola size in the operating room, and it's important for you as a patient to have a say in that. Do you like the way breasts look with very small areolas? Do you like very large areolas? What is your personal aesthetic? Because this is something that you can affect in the surgery if we know in advance. And then finally, it's really important to think about the scar and how important it is for you to manage the scar as best as possible. So I offer my patients scar treatments complimentary, and I also do Prevena-Vax on everyone, which helps scars look better faster. That's not always the case, and it's very important that you discuss with your surgeon what options are available to you. Some people are completely comfortable allowing the scar to just mature as it's going to mature, and other people want to do everything possible to make it look as good as possible and mature faster. So it's important that you ask your plastic surgeon at the time of the consultation, because some of these things like the Prevena-Vax need to be placed at the time of surgery. So there's a few things to think about going into your breast reduction consultation. Let me know if you have any questions or there's any other breast reduction questions you'd love to have answered.